Welcome. Welcome to Science, Health and Healing Library of Children's Health Core. I'm Dr. Majid Ali. The subject of this article is castor oil, sesame oil rubs for children. When, why, how, and where. I thought of doing this program because recently a mother asked me those questions. I thought none of those questions were relevant. I have a complete channel on castor oil therapies. Castor oil is the single best anti-inflammatory topical skin rub that I know. I recommend that we use it in rotation. You can use castor oil as a topical rub for 2 or 3 days and then bring in a sesame. Very rarely I see someone, if they use castor oil every single day, the skin becomes irritated. What actually amuses me is when people fire all these questions, 4 or 5 times I personally or our staff has explained to them that put castor oil wherever the body needs it. If the child has tummy ache, you put the castor oil, gently rub it. Put your child in your lap, put a little small amount of slightly warm castor oil, gently rub the abdomen, front, up, down, sides. If the child has a little cold, put it on the chest. If the child has a little sore throat, be gentle and put it around the throat. If the child fell and he seems to be limping a little bit, do this oil. Whatever other therapies that you're doing, I'm not going to bring that subject up in this program. I'm just trying to focus that none of the questions that people ask me, they're really valid. How, when, where, for how long, who cares? The point is, in my experience, castor oil is the single best anti-inflammatory topical skin rub for all conditions. If your child has an acute onset pain, yes, you should see a doctor. It could be the beginning of appendicitis. But if the child has had this abdominal colic, let's say your baby is only 3 months old and has had a lot of abdominal colics and you've seen the pediatrician 4, 5, 6 times, there's a pattern to it. Well, you can call your pediatrician, but take the child in the lap in the meanwhile. Before the pediatrician calls you back, just do the rubs. Most of the time, by the time you finish, it'll be gone. So, the message of this short story is, when your child seems to have aches and pains, let's say the child fell and seems to keep his neck bent to one side. Well, if you gently rub it and gently move it, you will tell. If the child screams with pain, you need to see a doctor. But if you are able to move this around and if you put a little oil and the child seems to be more comfortable and you do that again, 5-10 minutes later, the child is more comfortable. We have to apply the test of reasonableness. If the child falls and keeps the neck on one side but still walks up and is moving around, but that's not a permanent compression of the spinal cord. And then you can ask the child, just move your head around and ask the child to do that, and the child probably can do that. Now you can put a gentle little oil rub. So recently when someone asked me, an adult, I said, you know, when you pick up a castor oil bottle, ask the oil, hey, castor oil, where would you like to comfort me? Which part of the body? How much? For how long? And then look around and scan your body and ask the body, hey guys, which organ wants this oil more? In what form? Gentle rub, a little firmer rub, a little cold oil, a little warmer oil, a little bit less, a little bit more. And then you have a shirt, castor oil shirt. You have a pair of trousers, call them castor oil trousers, hang them separately in your closet. I thought of doing this program in spite of the fact that I've done many, and there's a whole channel on castor oil rubs that I prepared. It's amazing the ingenuity of the mind in raising questions to avoid just comforting a child or comforting their old injured tissues by simple thing. It will cost you 2 or 3 cents. So over the years, I have come to this rather unkind perception that when the mind asks these questions, it is really to trip the body. So again, for your child, wherever the child's body tissues want, however amount you decide. For how long, let the child and you decide. Which part of the body, listen to the body and ask the child to point out. Demystify this. Sometimes, I have seen these programs where they make a medical ritual out of it. You'll have to go to one of the southern states and they will tell you this is the only right way to do castor oil because some seer had explained that to them. And that seer, of course, was reading something where the Chinese were doing this. And he became an American seer. Demystify, demystify, demystify. Have the courage to become your child's primary pediatrician. Gentleness, high frequency. No, you don't have to compromise the issue that the child needs to see a pediatrician. That's not my point. My point is, while you have made that appointment with your pediatrician and now you are thinking, well, how can I comfort my child? Well, just try it. I would rather your child tell you the comfort that he gets from this gentle rubbing. If the child has a cold, you might try eucalyptus oil on the chest rub. Similarly, if the child has a sore throat, you might try menthol oil, but be gentle. Start low, build slow. Be kind and be gentle. Thank you for joining me. Children's Health Corps is a nonprofit foundation that my wife and I founded about 4 years ago. The purpose is to disseminate authentic health information untainted by corporate deceptions for people all over the world. You can support our vision, forward this YouTube segment to other mothers, other fathers, or your email, Facebook, or Twitter contacts. Thank you for joining me. Thank you so much.